Hello, doctors. Today I will walk you through the consultation workflow of ARAN Healthcare Management Information System. We understand that as a doctor, your main priority is to give the best possible care to your patients. Keeping that in mind, we have designed the system so that the platform provides you an intuitive and a very easy, modern clinical workspace where you can work easily without stressing out how to navigate. You get everything in the same screen so that you don't have to navigate here and there and can easily and quickly complete your consultation. So let me walk you through the system, right? Okay. So this is where I log in. Today I will be logging into the system as a gynecologist. I will be using my email and password. A doctor can also use their phone and PIN to log in. Since I am logging for the first time in the today, so the system is showing me the list of sessions I have. So I have a choice which session I want to since it's the morning. So I will join my morning session, that is session one. So here to pick up a patient, I have two choices. I can view my pick up a patient from my OPD queue, the patients who are waiting for me in the OPD, or I can start a new consultation bypassing the OPD queue. So let's see how the OPD queue looks like. So this is how the OPD queue looks like. So looks like I have five patients who are waiting. I have not started, so none of the patients are in the completed queue. So, so I have five patients, and this is my first patient. I start the consultation using Start Consult, right? This is one way. The other way of consultation is sometimes it happens that suddenly the doctor, emergency patient comes up, or due to some reason, the doctor wants the patient to see on priority or just for a quick consultation. For such cases, we have given another way of picking up a patient, that is this new consultation. Here, doctor can actually search any existing patient. You can search an existing patient, or you can even create a new patient and start the consultation. So for this demo, I will pick up the patient from the queue, right? So I click Start Consult. So here you can see that Miss Damini Sahi, her demographics are all here. I can see her age, gender, consultation ID, UHID, mobile number, and I can also see her past health records. So just click this patient health record will fetch me all the health records she has, whatever consultation I have done for her, and also the consultation of other department in the same clinic. So I can see all her uh, health records, prescription, clinical notes, and what was my previous clinical notes. So yeah, what are the prescriptions I have given? All these things I can see quickly here. And I can search since she's an old patient, and in her previous consultation she has registered what are the allergies she has, her family history, mother is a diabetic, her if she has any existing health issues like looks like she has a asthma. All these things can be recorded and it can be seen in here. So before even I start the consultation, I get the complete patient context here without the need of navigating to any other screen. So, doctors, here I would like to mention that one of ARAN's strength is its specialty specific consultation workflow. The consultation template actually automatically adapts to the doctor's specialty. For example, since I logged in as a gynecologist, you can see that I can record the menstrual history of the patient. And likewise, if there is a cardiologist or ENT, we'll get we'll see the clinical sections which are more relevant to them, right? So also we have given another thing, every doctor also has the flexibility to personalize their consultation screen. As you can see, I will just show you quickly how they can do that. Say they just click their preference and say, as a gynecologist, I also want to capture the obstetric history of my patient. I can easily do that. So these are the obstetric fields I can capture. So I can either select the entire group, or I can just select individual parameters that I want to capture. So let me just select the entire group. So as you can see, the obstetric history I can easily capture. And going forward, this will be saved in my profile, and whenever I open my for another patient, I get these details in my prescription. Okay, so now let's start documenting the consultation. As you can see, the vitals are already filled up. This has been done by my nurse when the patient was waiting in the OPD queue. Generally, that is the practice most of the clinic follows. But I have the access. I can see those recorded vitals. Now, let me just quickly fill up some of the fields. As I begin entering my complaints, patient's complaint or diagnosis, or you will notice that the system is providing me auto suggestions. These are intelligent auto suggestions which are powered by SNOMED City. Say my patient is complaining of pelvic pain since last 5 days. Nausea, these are the complaints. I can also write some notes. Uh, then diagnosis. My diagnosis is now this for medicines we have integrated the system with the common drug code of India CDCI, which is a database of 1,63,000 branded drugs which are used in India. Uh, so yeah, so I pick up the drug from my suggestions, and then frequency, then the duration, for how many days I want the patient to have this, some instruction code. Then I also want to give some antacid. So let's say, so the automatically the dosage comes here, and it's a tablet. Frequency I can just write as maybe early in the morning for 5 days before food. Okay, so with this, so as I said, these medicines are branded. You will get all the medicines which are, most of the medicines which are generally used in the Indian clinics. So, some investigation also, the system will give you. I select. I can write some advice, warm compression near pelvic will also, I can also, as a doctor, I can also, book the follow-up appointment for that. Say I want the patient to come after a week. So I just put it here. I ask the patient her preferable time. And the appointment gets booked for her. She also gets the appointment details in her WhatsApp. And with this, actually, I can complete my consultation. Before I complete the consultation, doctor, I want to show you another feature. Sometimes it happens that before prescribing any medication, the doctors wants the patient to go for some investigation, and based on the results of the investigation, they want to prescribe the medicine or do the further treatment plan. For such kind of cases, doctors can pause the patient by clicking this. So once you click this, this consultation goes into the pause queue, and you can start while the patient is going for the investigation, you can start seeing another patient. And once the patient is done, you can pick this patient from this paused queue, right? This is the paused queue. From here you can pick Damini Shahi, who will appear in the paused queue as a with a resume consultation button, so you can start that. So for now we have finished this consultation. So once I finish the consultation, let's see. So at this point, the doctor can print the prescription and then call the next patient from the queue, right? So once we click this print prescription, a PDF will be generated. A PDF will also go as a WhatsApp attachment to the patient. Let me show you the prescription, how it looks. So this is how the prescription looks. This is the header of the prescription. Then we have all the details that we have captured during our consultation. And this is the footer. All these parameters are actually configurable during the setup of the clinic. We will configure as per the clinic's choice. So once the prescription is given to the patient will also, of course, get a WhatsApp attachment, the prescription as a WhatsApp attachment. The doctor can actually call the next patient and complete his consultation. So the next patient from the queue has appeared, Ms. Kirti Shah. Here, before I finish this demo, I just want to quickly show that some doctors are not very comfortable to fill up a digital form for whatever reason. So for them, we have given free text. So the doctors can just write the consultation details here. Say headache. Something like this, and can complete the consultation the same way that you have done for the digital version of the RX. The prescription will get saved in the patient's health record. The prescription will be printed as is, whatever you are seeing here, and the consultation can be done this way as well. So thank you, doctors, for watching this video till here. Thank you so much. Please contact us if you want to show us some more videos, we'll be very happy to do so. Thank you.